Hi, how are you doing?
Hi.
I'm Jessica. I'm going to be the nurse today.
Okay.
And I'm Jennifer. I'm going to be the student nurse. I'll just be helping out Jessica today.
How are you
Nice to meet
feeling?
you. Good.
Doing okay?
Yeah.
Okay. I'm going to wash my hands. Will you verify your name and your date of birth for me? Just going to check out your arm.
Ravisto Levy, 67 years old.
Very good. And your 3 allergies that you're allergic to?
Peanuts, dog hair, and tetracycline.
Very good. Okay. So I have 3 meds today for you. We have lisinopril for your blood pressure. We have insulin for your diabetes. Your sugar was 290, so it's a little elevated. And then we also have your Vanco for your some kind of they infected saying that you have like a little infection. So we want to treat that too.
Okay.
We're waiting to see what's going on for sure, but we're going to treat it with some Vanco, which is like a through your IV.
Okay.
All right.
Okay, so before we start, would you give me a report on this patient, please?
Sure. So this is Mr. Levi Restivo. He's 67 years old. He came in on 7/3, which was today. And he came in because he was having increased blood glucose levels of in the 300s. He's had a fever, and he's had a non-healing ulcer on the right heel, which they've said that is now a diabetes or stage 2 diabetic ulcer on the right heel. He's got a history of hypertension. He has got diabetes mellitus type 2, insulin dependent times 20 years. He has he's a patient of Dr. Phillips, and he's a full code. He's alert and oriented times 4. He's got the gait is steady. He's got 20/20 mostly in eyes, but he does wear glasses at times. He has all his EOMs, his extraocular movements, and his pupils and everything. Everything is fine. He's got he's a little anxious at times. He has in the legs, he's got a little bit of tight tingling bilateral in both lower extremities. He also had pain at like 16:45. It was a 6. I gave him some morphine. So no, his pain's been out of 1.
Okay.
So
Good.
other than that, his lungs sound clear. Everything worked. There's no problems with that. Clear lung sounds. His 96% on room air, so he's okay with that. His heart sounds, it's S1, S2, no murmurs or anything. His pulses are 2+,
Perfect.
regular. Cap refills less than 3 seconds. His vital signs are ordered every 8 hours, and his GI, all 4 quadrants are soft, non-tender, round, and we're unknown right now about his last bowel movement.
Okay.
He's on a 1,800 calorie diabetic diet, and he's been non-compliant for the last 9 months. He's voided just a little bit ago, 320, yellow, straw color, everything else like that. He has a right IV in the forearm, 20 gauge.
Okay.
It was put in today at 1,600. He had his last vital signs were 100.1, and his heart rate was 76, and his oxygen was 96 as well, and the blood pressure was 132/70. And then blood sugar, like I said, we checked it at 16:45. It was 290, so he's due for 16 units of insulin. Also, his white blood cell count was high. It was like 195. Usually it's supposed to be anywhere from 4,000 to 10,000. So other than that, and hemoglobin was a little low. It was 10.4. And his hemoglobin A1C, we checked that. Usually it's from 2 to 3 months of prior activity of his monitoring his glucose, and it was 13.4, so it's elevated.
Oh, it's very elevated.
So other than that, we're going to give him the Vanco today for his infection, the insulin, and we're going to give him lisinopril for his blood pressure.
Okay.
And then also we're waiting on a wound consult
Okay, for a special ulcer.
for his ulcer, and he also had a chest X-ray today. Everything was clear, no infection causing that too. And then they did give us orders for a to dress his wound, because his wound is 5.5 centimeters in length and 2.5 centimeters in width.
Okay.
And other than that, that should be good for you. Everything's going good.
Do you mind if I ask you a couple questions
Sure.
about your the medications you're going to give?
Sure.
Okay. So why specifically is this client receiving this medication? So why are they taking the lisinopril, Vanco, and the insulin?
Well, the lisinopril, he's got history of hypertension, so we're giving it for him to monitor his to keep his blood pressure in range.
Okay. And how does the medication work on his body?
Well, it's a ACE inhibitor,
Mm-hmm.
so it's angiotensin is being made into angiotensin 1, and it's into angiotensin 2,
Mm-hmm.
and it's actually in the lungs, so we're trying to help to lower the blood pressure
Okay.
in the body, and to improve the blood flow through
Okay.
the body too. And then the Vanco, his white blood cell count was high,
Mm-hmm.
and it's also because of his fever, it's causing an infection.
Okay.
And so that one we are, it's one of the highest broad spectrum insulin, and we're waiting on the cultures to come back to maybe specify to change it. But that one is a B lactam, and it destroys the bacteria by destroying bacteria destroying the cell wall.
Okay.
Yeah.
And then the insulin.
And the insulin we're giving it because he's a diabetic,
Okay.
and so we're trying to control his sugars because he's a type 2. So
Okay.
he's still producing a little bit of insulin and
But
excreting
not
it, but
enough.
he's just needing a little extra help.
Okay.
And so those are going to help with the. 1 second, sorry.
Mm-hmm.
Promote cellular glucose uptake,
Mhm.
and also is used to move the glucose uptake. Yeah.
Okay. So when should you question giving any of these medications?
Well, lisinopril, if the blood pressure was under like 120/80,
Mhm.
if the heart rate was under 60, you might want to just maybe check on it. You might want to call the doctor and ask for sure. And so with that, or if he's having any allergic reaction too,
Mhm.
sometimes with the lisinopril it can cause you to have certain like angioedema, certain patients,
gotcha.
and cough. If there's a cough, we might want to maybe change it.
Okay.
The Vinco, if there was any sign of no sign of infection, you don't want to give it.
Mm-hmm.
And if the temp was normal, you know.
Okay.
And the insulin, if the blood sugar
Mhm.
was below, it's usually anywhere from like 70 to 120. So if it's anything under 70, you don't want to give the insulin. And if
Okay.
it's anything over, usually it's like we give it to like 301. So if it's anything you might want to call the doctor and get
Okay.
him to see what he wants to do about it.
Okay. And so, which does the medication have a therapeutic serum level?
These 3 don't.
No. Okay.
No.
And which vital signs do you want to monitor?
So for the lisinopril, we're going to check the blood pressure and the heart rate.
Mm-hmm.
And then for the Vanco, we're going to make sure that we're monitoring the temperature and the white blood cell count as well.
Mm-hmm.
And then the insulin, it's not a vital sign, but we're going to be monitoring the patient's glucose levels.
Okay, perfect. And just a couple more questions.
Sure.
What interventions must be taught to the client to ensure the medication is administered safely in a hospital setting?
So you're always going to ask them their name, the date of birth, their allergies, make sure that it's compatible, they can take this medication and are not allergic to it. Also, we're going to monitor the patient's blood pressure.
Mm-hmm.
And before we give the medicine and after, just to make sure that the medication is actually being effective,
Mm-hmm.
and the heart rate as well. And then the sugars, we're going to make sure that we're monitoring the sugars before and after we give insulin, and make sure that the patient knows the signs and symptoms of hypoglycemic and hyperglycemic, and the things to watch out for. And then Vanco, we're going to monitor the temperature, and we're going to monitor the white blood cell count as well. Make sure that everything's working with the Vanco.
Okay. And what interventions must be taught for taking the meds at home safely?
So at home safely, we're going to teach them to check their blood pressure and their pulse on like an automatic blood pressure machine.
Mhm.
And then the Vanco, which is IV here in hospital, they probably won't be going home with the Vanco IV.
Mhm.
So if they do, then they would teach them how to do it at home safely.
Mhm.
But usually they'll probably get them on something else.
Right.
And then the regular insulin, we'll teach him how to make sure that he switches sites and check
Okay.
his sugar and the signs and symptoms as well. And we're also going back to your home, or the one in the hospital, we're also going to make sure that he knows to call us if he needs to go to the bathroom, so he doesn't with lisinopril, so you don't get, it's called orthostatic high blood pressure, or orthostatic hypotension, which is the patient kind of gets a little dizzy when they get out of bed and their blood pressure drops.
Oh.
So we're going to monitor that and just make sure that he knows to call when he's going to go to the bathroom.
Okay, perfect. And what are the side effects and potential adverse reactions for each of these meds?
So for lisinopril, they could have angioedema, they could have hyperkalemia, hypotension. Like I was saying with the cough, sometimes usually it causes a cough, dizziness, headache, stuff like that.
Okay.
And Usually they're sometimes it can cause you to have a irregular pulse.
Okay.
Too, so we'll monitor that. And the Vinco, we're gonna monitor them for. It's called anaphylaxis,
Mhm.
and so that's kind of like an allergic reaction.
Oh, gotcha.
So they could have like a rash, they could have problems breathing,
Mhm.
stuff like that. And then they also have neurotoxicity and phlebitis too from the IV site. It could get inflamed, not inflamed, but yeah, inflamed,
Mhm.
infiltrated. It could be red and itchy. So that we'll like monitor that too.
Okay.
And then the insulin, we want to check for the hypoglycemia
Okay.
and make sure we're switching the IV, the injection sites so that they don't end up getting tissue bruise. And it's called lipodystrophy.
Okay.
Dystrophy. And then-
Lipodystrophy.
Yeah.
Okay. And last question: how
Sure.
do you know the medications are effective?
So for the lisinopril, it'll be hopefully decreasing the blood pressure,
Okay.
and we'll make sure we monitor where it doesn't get too low.
Okay.
And then the Vinco white blood cell count will come down, the fever will come down, and hopefully the cultures will come back negative.
Okay.
Between the 4 and the 10 for the white blood cells
Right.
as well.
Normal ranges.
And then
Okay.
for the insulin, we're going to make sure that the blood sugar results are decreased.
Okay. Perfect. All right. Those are all my questions for right now.
Okay,
I'll have some
sounds
questions for you after.
Cool, no
Later.
problem.
Are you feeling okay?
Thank you.
You're welcome.
Okay, Mr. Levi, so I have 3 medications for you today. We're going to have your lisinopril, which is your blood pressure medicine, the insulin for your blood sugar because it was 290, and then also the antibiotic.
Mhm.
Okay, so we're going to go ahead and do that now. Wash my hands again. Gloves. Okay. So are you used to taking these medications that we're taking today? The lisinopril and the insulin,
Not the vancomycin.
the vancomycin. So that one is an antibiotic. And it's because they were trying to rule out, they said because of your ulcer, it's like it's an antibiotic for your infection. So we're trying to get the infection to be better, less painful, and so you start to feel a little better. So that's usually a couple times a day. It's usually 2 to 3 times a day that we'll give you the antibiotic. And I actually have some education pamphlets for you, and we'll go over that too. Some of the side effects that you should look out for and everything like that too. Okay. And your blood pressure recently was the 132 over the 70. Just so you know. Okay.
Is that why you're giving me the lisinopril?
Yes. So will you verify your name and your birthday again for me?
Revesta Levy, 67 years old.
Okay, and you're allergic to?
Tetracycline, peanuts, and dog hair.
Very good, okay.
And if you want, I can read you the barcode.
Okay, sounds good. I have it here too, but
Oh.
I'm gonna scan your armband.
Sweet.
Alrighty. Give me 1 second. Alright, and then we're giving him lisinopril. He's getting 10 milligrams daily,
Okay.
so it's just 1 time a day. And we did verify his blood pressure already. I'm going to get this here. I'm going to scan it and make sure right here, lisinopril 10 milligrams. Alright, everything looks good. I'm going to go ahead and enter this in. It's hard doing this backwards when you're
Mm-hmm.
doing it manually. Old school. Okay. Okay. Everything looks good. Okay. What's that? Oh, yeah.
So we have a green light. Yeah.
Okay. So this is your lisinopril, and I have water for you too, okay? So I'll get this to you. And I'll get this to you too as well. Oh, yeah. There we go. You can give it back to me and I'll put it back up here for you. So it's out of the way. Okay.
So the lisinopryl's done.
Yes. So I know you've been taking it, that medication, but some of the side effects for lisinopril is if you have a cough, make sure you want to let the doctor know. It could cause you to have dizziness, a headache, and make sure you call me when you got to go to the bathroom because your blood pressure could drop too. So okay. Over. And then the next one is going to be, we're going to do the regular insulin. So I'm going to scan your armband again. All right, and verify your name and your birthday for me.
Ravista Levy, 67 years old.
And your allergies.
Tetracycline, dog hair, and peanut.
Very good. Sorry, I know it's repetitive. You probably get tired of hearing it. So usually not in this facility, but usually you're going to you're going to have the sugar in front of you, and usually because it's a short acting, you want to make sure that you're giving them their food between 30 to 45 minutes,
Mm-hmm.
and so that's a good thing too. And then usually in other facilities they make you verify what you're giving to the patient and the amount of units that you're giving to the patient. But
Okay.
this facility we don't.
Okay.
So that's the only different thing that you'll see
Okay.
in different facilities. And you always want to ask them where the last time they were gave the medicine, so we don't give it to them in the same place.
Okay. I think you have 2 5s.
All right, I'm going to scan your armband again. Okay, and then we're going to give Novolin or insulin regular. We're going to give them 16 units. Scan the armband or scan the barcode.
You already did 2.
No, I have it right here.
Oh, okay.
Here we go. Or have you been watching what you eat at home or trying to go by a certain diet?
No.
No. Would you like for me to put a consult in to have someone come talk to you about maybe picking some right choices in food and stuff like that?
Sure.
Okay, might help you a little bit. Okay. So this, okay. So what this is, you always want to, you usually always clean the top.
Mhm.
Make sure that you clean the top. Usually it's like clean it like you mean it, like 10 seconds. You just want to make sure it's all clean. And then also you want to, we're getting 16 units today. So you're going to inject the 16 units into the insulin
Mm-hmm.
bottle before you pull out the insulin.
So the air.
So the air, yes. Air first, yes.
So we don't contaminate the needle.
Yeah, so everything's all sterile. You don't get the patient. So like I said, usually in some facilities they watch you. We're just gonna draw out 16. Alright. So you wanna just make sure you don't bend the cap, so just go easy.
Okay.
Okay, and once it's in there, we're going to pull back the 16. And when you're doing this, you want to make sure that you don't have no air bubbles or anything in it.
Okay.
Like this is. So just, you would check, it's like 16.
Yep.
No air bubbles. And so with this, you don't want to ever recap, so you always want to put it against something
Mm-hmm.
and then just scoop it in. It's a scoop method. And once it's in, usually, hold on a second. Then you can pull it down.
Okay.
So you don't feel like you're capping somebody.
Okay.
Okay. So we're going to make sure everything, we're going to check this out again. We got 16 units. It's going to be regular insulin. Everything checks out. Okay. What, the last time they gave you insulin, where did they give it to you?
My left abdomen.
In your left
side.
abdomen? Okay. All right. So we're going to give it in the right if that's okay with you.
Mm-hmm.
Okay. Very good. So I always put this down here. And we're going to clean it like you mean it. We're gonna let that dry a few minutes. Make sure when you're also getting insulin, you always want to pinch. Some people don't, some do, but it's usually good to pinch, and then you go in it between 45 to 90 degree angle.
Okay.
You want to go into it too. So, okay. So go ahead and do that. Okay. Very good. And when you want to pull back, we're going to go ahead and put it in the sharps container. Very good. How does that feel? You doing okay? Have you been having any bruising from your insulin shots?
No.
No? Okay. So just always remember you want to make sure that you switch up your sides when you're getting
Yeah.
insulin.
You were gentle.
Oh, thank you. And then just also the side effects you want to look out for, like, it's called hypoglycemic if you're clammy, if you're having dizziness, usually if you're hungry, sometimes it make you hungry too. A little confused, you want to look out for that. And if it's high, usually like really thirsty or having to go to the bathroom a lot. So just kind of like look out for those signs too when you're at home too.
Okay.
Okay. So the last but not least we have is your vancomycin, the what do you call it? Antibiotic. Sorry, brain fart today. Sorry. Alright, so I'm going to scan your armband again and verify your name and your birthday for me.
Reese Levy, 67
Very
years
good.
old.
And your allergies one more time, I know, sorry.
Tetracycline, peanuts, and dog hair.
Okay, very good. So for these, you always want to make sure we're monitoring the white blood cell count, and we're going to monitor his fever. And the fever earlier, it was like 100. It was 100.1, so it's coming down gradually.
Okay.
And we're going to be they give him Tylenol early during the day.
Okay.
So we're going to do that. Okay, we're going to do your first. You always want to do your primary line first.
Okay.
So we're going to verify, make sure that nothing's wrong with the bag. Check the bag out. Everything looks good. So we're going to scan off this one. Yep. And the expiration date, you always want to do that too, which is good. 2025. A long time from now.
Yes.
All right, so I'm going to scan that, and I'm going to put this in. So before, and then this is called primary line. And then so we're going to set it up with the pump.
Okay.
Before you do any of that, you always want to make sure that his IV line is good and there's no infiltration going on. If it's burning or anything like that, so we're going to check that out. And you always want to flush the line
Okay.
before you do anything. So before that, okay, Mr. Levi, I'm going to check out your IV line. Is it hurting at all or causing any pain? No. When they've been using it, has it been burning at all or no? Okay.
No.
All right. So I'm just going to check out your IV line here, make sure everything's okay. So yeah, you just always want to check it out before you do anything.
Okay.
And make sure that it's peeing and everything looks good. So we're going to always want to scrub. Usually it's like for 10 seconds. Keep it all sterile. Okay. And then we're going to flush. Always want to keep everything sterile so we don't give them. Okay, I'm gonna aspirate a little bit back, make sure that there's blood return.
Yep, blood.
Very good. Okay. And then I usually just do it kind of slow. How's it feeling? Is it feeling okay? Are you
Mhm.
hurting or burning or anything?
No.
No. Okay, very good. Take it out. And then I always just put these, make sure you put it in the sharps container.
Okay.
So we'll put it there. Okay, everything looks good. All right, so I'm gonna hang up your IV line now, okay? So this is just gonna be regular fluids, and then I'm gonna put your antibiotic too, okay? All right. So I'm gonna scan this already, and they have this ordered for 30 mLs an hour.
Okay.
So I'm gonna plug it into the pump and everything. All right. And with this too, you wanna make sure that you're looking for expiration date and everything doesn't look like it's opened, or you wanna keep everything sterile. And I always take everything off. So before you do anything, you always want to make sure that you have it clamped.
Okay.
Always. Because if not, once you make that mistake, it's going to be everywhere. And then also before you do anything, your IV primary tubing is good for 96 hours.
Okay.
So it's usually like 4 days. So you always want to make sure that you label before you do anything. So I'm going to date it at 7/17. Okay. Yeah, they got them all. Okay, very good. Everything's clamped, everything looks good. Okay. Alright. So we're gonna undo this. And you wanna keep everything sterile. Try to keep as much as you can. And then when you're doing it, make sure that you're putting it in gentle because it can poke through the sides.
Oh, gotcha.
So just kind of make sure that you're gentle. And then push as much as you can.
Mhm.
And then we're going to prime it before we do anything. And then this is when you're going to not make sure it's on the floor. Unclamp it. You always want to make sure that you have like at least halfway so that you have it. And then
Oh, the little bubbles.
it'll flow. I always like to hang it on here. Sometimes it's a little bit easier.
You got it?
Yep. Make sure I'll by you. So it's coming out really slow today.
No hard time.
Yeah. Hmm. Yeah. And make sure that you get all the bubbles out. This is like starting to get really. You never want the pump to beep, so it's really not
Do you think if you put it down,
Like put it down more.
put this down?
Well, usually you're supposed to put it up so that it drains.
Yeah, but the bubbles. The
Yeah.
bubbles are gonna want to go up.
Usually you're supposed to put it up.
And the bubbles are gonna go up towards the air because they're lighter.
Sometimes.
Let's do
I don't know.
You know what, the machine going on every 5 seconds.
Yeah.
It's almost done. Just these bubbles right here.
I think it's not really coming out very fast.
It's almost done.
Looks better.
I think it'll.
Looks a little better. These are still. This is like very nice even too.
Yeah. I got most of the bubbles out.
Is they're all out here though? There's still some
I
there.
don't think so. Yeah, but I think they're good.
Okay. So we're gonna clamp it. Looks like I don't know. There's still some greasy.
Like, we'll figure it out, I guess, when we put it in. Be able to do this.
Okay. Alright. So you're gonna turn on your pump here. It's gonna say system on.
Mm-hmm.
Usually beeps for a few minutes. Alright. So we're gonna put this in here. Yes, I know. It's gonna say new patient.
Mm-hmm.
And then he's on the med surgical floor, so you're gonna push continue. Alright. Usually we're gonna scan the pump to make sure that it gets off too. And then we're going to confirm. These are called basic, it's just called basic infusion.
Okay.
So we're gonna hit this button. And then the rate, we're having it at 30 mLs an hour.
Okay.
So we're gonna type in 30. Alright, and then the volume is usually what's in the bag, and there's about like 500. Alright, and then I'm going to take another alcohol pad here, and I'm gonna clean her hub again too.
Okay.
Jenna, I'm gonna hook you up to your IV let's do, okay? Alright, verify your name and your birthday for me.
Vista, Lemmy, 67 years old.
Very good, okay. So you wanna keep everything sterile. Alright. I'm sorry, Jenna. Okay, and we wanna make sure that the guardrail's open. Okay, and then we're gonna push start. Make sure everything, you wanna watch it just to make sure that it's dripping. It's going, it's just really slow. There we go, okay, very good. Okay, so now I have your Vanco for you, okay? So for this one, go right here, 1750. Took us a little bit, sorry Jenna, to get the bubbles out. Mr. Rosito.
I'm gonna show them the green.
Oh, yes. Oh,
Green light.
how's it feeling? Is it doing okay? Is it hurting at all? Burning
No,
at all?
no.
Looks good. Okay. And then you also want to put where you put your site at,
Okay.
too. And where you have it in the right form. So, here's that one. Okay. And then we have, last but not least, the Vanco. Okay, so I'm going to scan your armband again. Can you verify your name and your birthday for me?
The Ravisa Levy, 67 years old.
Very good. Okay. Medication for giving vancomycin. So this one, like I said, you want to make sure that you're monitoring her fever and her white blood cell count as well.
Mm.
Okay. Green light. Oops, sorry.
Green light.
Okay. All right. So I'm gonna check it again. Make sure I have it. Vancomycin. It's a 1,500 milligrams, and they want it. It's 250 mils. So we're gonna run it over 2 hours. So it's 125 milliliters an hour.
Okay.
And so usually you just find that at 250 milliliters divided by the 2 hours, and you get the
175.
125 milliliters. Yep. So you want to make sure everything looks okay with this. It looks good. And then this is also called your this is your secondary ticket too. So we have another alcohol pad here. Just a second. We're going to take this out of the package. And your allergies again are, sorry.
Tetracycline, dog hair, peanut.
Very good. Thank you, sir. How's the IV feeling okay right now?
That look good.
No pain or burning at all? Okay, very good. So for this one as well, we're gonna take off the stuff to it. And you're gonna also wanna clamp first too. And then with this one, these are good for 24 hours. So we'll be changing this tomorrow. So you always wanna make sure you clamp and you label before you do anything. Okay, everything's clamped, everything is good. Like I said, with these two, everything has to be sterile.
Okay.
So with these two, and then for these ones too, primed, it's called backflow, which is where you're going to take this bag and it's going to be lower than your primary bag. Alright. Okay. And make sure everything's sterile. Like I said, with these ones too, you want to be careful so you're not poking the bag through it. Okay. So for this one, I'm going to hold on to this. Alright. Alright, and so up here, we're going to make sure everything's running. I'm going to hold that for 1 second. Alright, so for this one, you want to clean it. This right here, the port, and you want to keep it as sterile as possible.
Oh, okay.
Okay. And then we're going to put this on. Okay. Right here. Okay. So we're going to take this off. You want to hang it low. So you want to make sure that it's low. Lower than the secondary line. Everything looks good. Okay, so what we call it is called backflow. So what we're going to do is we're going to, let's see. We're going to do secondary.
Mhm.
And then for this, we always want to make sure that you're verifying it's Vanco.
Vanco.
And we're going to run it at 125. So you're just going to scroll down until you get to the V. All right, and it's Vanco. So we're going to push vancomycin. And then it's 1500. So we're going to put in the 1500 here. Okay. And so I'm going to do it. Yeah, I'm trying. Okay. Yeah. Okay, so the drug amount 1500. Alright, and then the volumes in here is the 250 mLs.
200. Okay.
So that's what you want to do in the volume. Okay. So before we do all that, you want to make sure that we're gonna backflow it too. Okay. So we're gonna make sure that you're. I know I'm hurrying. All right. So. Oh, there it is. Okay. And it's filling up. You want to watch it. Unclamp it. Okay. So now we're gonna clamp it back, and I'm gonna put it higher than my primary, and make sure that. Okay, we're going to open it back up. Make sure everything looks okay. Next. Oops. So rate at, we're doing 125 an hour. Yeah. Alright. So that's 125. And then 250, yep. Alright. And then it's gonna, and then you just have to watch it for to make sure that it drops, the 5 drops. How's your IV feeling right now, Jenna? Is it okay? I'm at Recibo.
Oh, it's fine, okay.
Okay. Everything looks good. Okay. Just making sure everything looks okay. All right. Very good. Okay. So let's see what I missed here. All right. Just wash my hands again. How are you feeling right now, Mr. Recibo?
Good.
Doing okay? So, like I said, I print you out some education pamphlets. It's going to go over all your medicines that I gave you. And so for the regular insulin, like I said, you want to make sure that you're changing your spots when you do your insulin dosage or your injections, and that you want to make sure the side effects are it might give you a headache, or sometimes it can cause you to be very clammy, sweaty. So we want to make sure you're checking out for that. Make sure that you're eating okay.
Okay.
For the Vanco, I'm gonna make sure if you've any kind of a rash, or if you're feeling like it's burning, or if it's starting to swell up, make sure you call me and let me know about that. And then for the lisinopril, that one is sometimes it can cause your blood pressure to go down, so you want to make sure you call me before you get up and go to the bathroom. And it can also cause you to be dizziness, so just kind of make sure you look out for those kind of things. So I'll give you these.
Thank you.
All right.
And I just have a couple questions.
Sure.
So were there any pertinent pieces of information you received before administering the client the medications?
So you want to always make sure you look at your allergies
Mm-hmm.
and look at their white blood cell count and their vitals, and the kidney function is usually it's called the BUN and the creatinine. So you always want to make sure you look at those.
Okay, and did this information affect your decision to administer the medication?
No. And if it did, I wouldn't have gave it. It would have been like if her blood sugar was too low or if the blood sugar was too high, I would have called the doctor. And then with the blood pressure as well, they gave us parameters. So if the blood pressure was below, the systolic was below 190 or greater than 180, or if the diastolic was it was greater than 110, I'd want to call the doctor and get with that too. Or if it was below the normal range as well. And then the heart rate, if it's below 50.
Mm-hmm.
I'm not gonna want to give it. And then if it's higher than 110, I want to call the doctor and make sure he knows that he's aware of the blood pressure as well.
Okay.
Yep.
And did this information affect how you administered the medication?
No.
No. All right, and I think that's all the questions I have, and we're going to document. Yeah.
Yeah.
Okay.
We're good.
Just making
Mr.
sure.
Recibo, is there anything I can get for you?
No, I'm just looking over the pamphlets.
So if you have any questions or anything, you let me know and I will answer anything for you.
Alright, thank you.
Oh, you're very welcome. Wash your hands. Make sure you have your call aid. All right, thank you.